This is a quick video to show the nursing discharge process is used in PowerChart. This is for inpatient discharge process. What I'm showing you now is a discharge dashboard, which is found at the top here under discharge. And I've set this to a test ward, as you can see. This is the full ward that I'm showing. And at the top, I've got a patient that I'm going to be demonstrating on today. What I'm showing here is the columns that you can see in the discharge dashboard. I'm going to use this to help me explain exactly the processes that need to happen before the discharge summary is sent to the GP, which certainly from my point of view is probably one of the most important things. There are lots of other important things about safely discharging the patient, which I'll cover as well. So here we've got the patient's details, as you know, the location, visit, the consultant in charge, the most recent EWS score, discharge overview, which is from the criteria to reside power form, discharge order, which on this patient has been placed. And I will quickly show you, if I can remember, how that gets placed here. TTOs will be visible here as to whether they've been had the reconciliation done. This is the person completing record. This is a field which is done by the doctors, and it's really important because this is one of the triggers to send the GP letter. This is the GP letter, or GP discharge letter, GDL, and this is another tick box saying that this has been completed. Now, what this means is that on this patient's record, there is a discharge letter which has been signed. Okay, that's all it means at the moment. Here we have I'm going to skip a column. We've got the KDD, the key discharge details. This is one of the final documents that you will do to say where the patient has gone, what date, and who was the discharging staff member. And this will, when you complete that power form, this little dot will go green. And at that point, once these three things are green, your patient ready column will also then go green. Now, once all of those things are in place, when you do the PAS discharge, i.e. the discharge from the bedboard, this will automatically then send the GP discharge letter. So let's go into this patient and take a quick look around. I'm here now in nurse view, which is the standard set of M pages. I've actually just restricted down what I can see here, and this is the discharge M page that we're going to concentrate on. Lots of other things to talk about, but I'm going to really stick to this for now. I've done a few things here, in that over here on the side, I've looked at components, and I've unticked a few things that I'm not that interested in seeing in this page to make it clearer. What I've also done is make sure that I've brought and moved around these components, which you can do just by clicking and dragging, and it will just literally move them around on the list. And I've ordered these in a nice simple way, with the most important things at the top and the things that are least important at the bottom. I've also done something else, which is to use what's called contextual view. So in these text fields, which are these fields on the right, I've brought these across. If I show you here, this little button brings this from this side of the M page across to the other side of the M page. So now you have what's called contextual view, which is to be able to see data on the left-hand side and text boxes on the right-hand side. And along with all other M pages, this workflow M page is designed to safely do the discharge of a patient. And this mostly includes doing the TTOs, the safety checklist, the discharge information form, and creating and updating the inpatient discharge summary. So quickly going to go through this. So here are the things that you will need to do prior to discharging the patient from the discharge M page. The key discharge information field is here. So here is a requirement. You can see it's got a red asterisk that you have completed at least one of these power forms. Let's complete one now. So this is where you're discharging the patient to. Discharge with consent, usual place of residence are the very common ones. And then here, the discharge date and time. I'm just going to put today's now, and I'm going to put my name in here as a discharging staff member. And then we sign this form. This will then turn this to a green tick to say that that information is now there. And you can see here that these results have now been placed underneath there for ease of viewing as well. Now, what we're going to do next is have a think about the other things that we're going to need to do, because the things immediately prior to discharge that will need to be completed are covered off by the nursing discharge checklist. This is completed here by clicking on the down arrow, going to the nursing discharge checklist, and here you will see another power form. This is the test patient. So normally you would see the most recent set of observations here, and you can complete who's done those at the top. And this tick box to say is to basically say that since this last set of hopefully normal observations, or within reason observations, and the patient has not deteriorated since then. So I'm going to click yes, assuming here that we'd have some normal observations. The other checkboxes here will populate that discharge dashboard that I showed you at the beginning. So one of the columns was the discharge safety checklist, and each of these yellow items is a space on that row, and so you'd be able to see where you are. So if you've done some of these things but not quite all of it, it will show you that status. So let's say this patient has been seen by the physios, they are happy, and so we have an AHP readiness of yes. These are checklists which you can go through, and I'm not going to go through all these things individually one by one. It's all fairly obvious, but just to highlight certain things, you can make it easy by clicking on the top, and that will just highlight the entire row. And if it's mostly no or mostly yes, and just one thing that's not right, you can just change it like that. So obviously this is not just correct, I'm just making this up, but that should give you a quick way to do those things. Once you've completed all these things in the column, then you would complete yes. If there's something that's not been fully completed, you can click no. That's okay to do that, because you're going to come back to it later and finish it off just before you discharge the patient. So let's just finish off these for now with no, just for now. So no for all of these, and now we can save the form. And just very quickly, we'll refresh the page. It's always worth refreshing all the time here. And we'll go back to our dashboard, the discharge dashboard, and we'll have to refresh this as well. Each view needs refreshing individually. So just keep refreshing the whole time. Now you can see here, and this is where that's now populated. The discharge safety checklist is here. If we can't quite see it, you can just drag the column to make it a little bit wider. If you can't see all of them, one of the main reasons why is that you may not have set up your layout to show here rows, 5 rows. This is how I've set mine up, so I can have, there's 5 different rows in each of these rows basically. And that means you can see the most information, and I recommend that you do that. So very quickly, what I'm going to do next is show you a Care Compass, which you're now going to be very familiar with Care Compass, because here you can see that I've got an entire ward. So this is quite useful for a ward manager to look at an overview of the whole ward, see where we are with discharge process for all the patients, and you'll be able to filter, sort this list by clicking on the headers here, and this will show you which patients have had which bits done or which haven't had which bits done, so you'll then know which patients to concentrate on. So we're going to go back into Care Compass. I want to show you one quick thing here, because here you can see obviously that I've now got a bay indicated here. So my patient, this is based on a bay, and it's really important that we do this, because if you try and put an entire ward, then you'll notice here that the care plans section has just disappeared. So if you have any more than 10 patients on this Care Compass list, then it won't display that, and that's because Care Compass is designed for sort of more bay work. Okay, so you can have multiple bays set up that you can flick between. So if you're looking after multiple bays, you would just flick between them, but as long as you have less than 10, then you'd be able to see the plans of care column, which you see is now visible. So here's the patient that we're going to concentrate on, and you can see that I've already started the discharge care plan. If that hasn't happened, then when each patient is admitted, you will see that there will always be a suggested care plan. I'll very quickly look at this other patient, this second patient here, and on the left here, you'll see under suggested plans that there's a nursing care plan of a discharge care plan, which is suggested. This is automatically suggested. So what you need to do is click on that and then accept it. First of all, then you'll see that it pops open a variety of different phases of the discharge planning. And this first one is on admission, which we will always initiate now. But we can also, when we're actually ready to discharge the patient, then you would do this prior to discharge. And this is the one that places the discharge patient status order, which is the one that feeds into the ClinOps board, so that the bed managers know what status the patient, if the patient is ready for discharge or potential or actual. But you can also see here there are other parts of this phase which were for complex discharges or for rapid discharges. I'm not going to cover those right now, but this is what you would do. I'm going to cancel this for now because I've already done this on a previous patient, and you can see here that this plan of care is now active, and any other plans of care incidentally would be on here as well. So for instance, if there's a blood transfusion care plan or any care plan that's been activated, you'll see those here, and you'll be able to then click into them, and over here make sure that you've actually selected the particular care plan that you're interested in, and then you'd be able to see that plan of care and where you are with it. But actually documenting into that plan. So if there's tasks or these items here are sort of indicators that of safety and things that we should try and do, then you would be documenting in plan. And that says on this tab here, and you would be familiar with this hopefully already, where you can see here are all the tasks, indicators, and it would just document to say, yes, we've completed that particular task. Now I'm going to try and stick to the plan and keep it short. So we're going to get back into this patient now. We'll reopen this patient here. And now you can see that on our workflow M page here, we've got a few nice green ticks, which means that essentially now this patient is pretty much ready to go from the point of view of Cerner and the point of view from the discharge summary. And there's a few other things we want to check. So in terms of the discharge meds, because we want to obviously check to make sure that that's arrived. So this patient it's got a green tick to show that say the doctor's done the TTA meds and that they've completed it. And they're happy that this is the only thing that needs to happen. This med has now been assessed by pharmacy, and obviously you'll check your standard workflows on that. So either discussion with the pharmacist who's done the screening, or using PTS to see the progress of any pharmacy issued drugs that need to come up. But you can obviously check here to see which of the pharmacy supply drugs that will need to be given to the patient and want to come up. So you can see that here. And here is where, when your patient's ready to go, you would highlight, click given, and then click sign to say, yeah, I've given that patient's now been given that drug, and it gives you an indicator of all the things that should happen. You'll see on this list other things. So if they have patient home meds, they will be on this list. If they're at home, you won't be able to say that they're given clearly because the patient's got them at home. But that just helps you understand that we won't need to be issuing more drugs for that particular patient. So things like the pod locker drugs would be on here as well. So again, you can tick those as given as well. So that's a process to help you make sure that all the TTOs that are listed in the TTO section, in the discharge medication section, have been issued and given to the patient. And that's one of the things on the discharge safety checklist. So you'd be able to go back to your discharge safety checklist here, reopen, and you can come back in and then update the part which is the discharge, the drugs, basically the TTOs, medication readiness, and you would say yes when that's now been done. Okay, so that's kind of how you'd be processing through these things, by completing certain things in the work list and then going back to the discharge checklist to complete the checklist. And that will keep the discharge M page, the summary M page, up to date with where we are. So finally, I want to mention something about the actual creation of the note, because this is really important. So prior to doing anything with the inpatient discharge summary note, you'll want to make sure that you've completed the key discharge information, okay? Because this detail is going to pull into the discharge summary. And if you haven't completed this first, before you do this next part, then the discharge summary to the GP won't be complete. There's a few other things that are really important, and the reason why I'm going to show this next stage is because of the way that we're working in a team here. So all of these text fields are shared amongst everybody. So everybody has a discharge M page. The doctors, MDT, team members, nursing team members have access to the same fields. So it's really key that you don't just delete things that are already in these boxes, because these would have been placed by potentially other team members. And you'll see that there's my name here. So if there's a name in this box, it will tell you the last person that's modified that field. If you do modify it, which you clearly can, and if you're given more information to the patient, let's say, you can come into the field, document what information you've given. You might put your initials and update with what information has been given to the patient, and then click save. That would then save with that most up-to-date information. Now, this is really important because if MDT team members have come and updated it since the doctor has created the discharge letter, which you can see here, by the way. So if we go to documents, you'll see there's a whole list of documents here. Here is the inpatient discharge summary document. I can just click on it and it will just quickly open. And you'll see that it's been created a little while ago, and certain things won't be up to date because we haven't refreshed it yet. Now, other things particularly that won't have been updated would be also any new discharge medications that might have been added to since the doctors created the initial inpatient discharge summary note. So if they've added something to it after they've created the discharge summary note, when you open the note, you won't see it, which is why this next part is super really important. So when you will finish all these things in your workflow M page, come down to the bottom where it says create note, and underneath that there's only one option that you need to look at, and this is the inpatient discharge summary hyperlink, the blue text, and you click on that. It will then say Usually, and this is mostly when the doctors have already created it, but if they haven't, but all the other things are completed, feel free to create a new one. So it's okay if it's creating a new one. So here we already have an existing discharge letter. So we're going to always make sure that we open the existing note. Don't create a new one if there's already one existing, and we'll continue. The next box will give us two options to choose, and you must always choose revise note. Don't choose to addend the note, please. So then we're going to click OK. And now you'll see here is the previously saved discharge summary. Go up the top as well and show you the other area, which I was talking about earlier, the key discharge details. So at the moment, the only thing we have pulling through here is the discharging ward. So the details of who's discharged them and when they were discharged, which is really important for the discharge summary, it won't be pulled through until you've completed the key discharge details. So here's the trick, and it's a little bit silly, I'm afraid, but this is little thing here. It says refresh, and a little up arrow is pointing to something that you can't see yet until you hover over this area. Okay, so I'm going to highlight, make sure this area is highlighted, and up here you can see now a little swirly arrow, different to this swirly arrow. So don't be confused. This up arrow isn't pointing to this one. It's pointing to this hidden one, which you kind of have to activate by either hovering over or sometimes clicking on. You click on this, and this will refresh everything on the notes. So now you can see discharge details have now refreshed. Now you can see all those things that we put into the key discharge details form. If we scroll down, right down here to, here we go, the medication is now definitely listed. And you can see here also that it's been screened by the pharmacist. Now, if this is still blank, when you've done that refresh, then you'll know that this TTO has not yet been screened by the pharmacy team, and you'll want to make sure that that's been done. You'll then have to come back in here, obviously, later, and then redo the refresh once that screening's happened. So let's go down to the information and advice given page part, where you can now see that extra bit of text that I added into the information and advice given on the M page is now updated. So now we have the inpatient discharge summary letter updated. And once this is done, you'll need to sign it. You must always sign it after you've refreshed it. So don't forget, open, existing, revise, refresh, and then sign. Okay, so those are the steps that you have to do to make sure that this discharge letter is now up to date. Once we've updated it, we can then reopen the discharge letter from here. We're going to print that document here by clicking print, and we're going to choose the document template to send, so we can give this to the patient. So we're going to do document template, and the purpose is for patient or guardian and personal use only. And then we can, I think the easiest way, to be honest, is to click preview for this, because then that allows you to print to any of the standard printers using the standard print function from this Adobe page that you can see is now opened. So we'll open that here, click print, and then you'd be able to print to any of the Follow Me printers. So now we've printed, and we can give that to the patient. Now we can finalize, go back to the checklist again. We will now finalize our checklist again to say, yep, now we've completed everything. Okay, I'm not going to do all these things correctly, but let's say it's appropriate that we've just quickly tick yes for all these things, and now we can say yes to everything. We're now happy that we've done all the things on our checklist. Some things obviously maybe NA, but let's go with it for me. And then we'll sign that. Now we know that finally discharged from the bed board and goes home, that discharge summary will be going off to the GP automatically. Thank you very much.